If you have had a sentinel lymph node biopsy or axillary lymph node dissection, it is very common to experience discomfort, tightness, numbness and/or tingling in the underarm and/or back of the upper arm. Most often these symptoms are manageable and resolve with time. During any axillary surgery, there is an unavoidable disruption to the superficial sensory nerves that provide feeling to the skin in the underarm, lateral chest wall along the ribcage, and around the upper arm, specifically the back of the upper arm, but not beyond the elbow. This can cause discomfort after surgery and may be more painful after an axillary lymph node dissection. Symptoms may include numbness, pins and needles, aching, burning, tightness, and sometimes itching. If you experience these symptoms, they can last for up to 6 to 8 weeks after surgery, but are expected to improve over time. In some instances, a small amount of numbness in that area can be permanent. There are a few things that may help with discomfort, including regular stretching and gentle exercises to maintain arm and shoulder range of motion. If nerve pain is severe, medications can be considered. A few options include gabapentin and pregabalin. If range of motion issues persist or worsen, your provider will refer you to a physical therapist. Axillary cording, also known as axillary web syndrome, is a condition that may occur after axillary surgery, either a sentinel lymph node biopsy or axillary lymph node dissection. Axillary cording looks and feels like you have a cord-like taut band or bands of tissue that extend from the armpit or axilla along the inner arm towards the elbow and sometimes into the forearm and rarely into the wrist or palm. Axillary cording can develop anytime after surgery, but most often occurs in the first few weeks. It can be painful and limit range of motion in the shoulder and sometimes the elbow, but it is not dangerous and most often resolves within a few weeks. If you receive radiation therapy after surgery, axillary cording may also develop after radiation. There are several ways to treat axillary cording, including gentle massage of the cord-like area during or after a hot shower, and performing gentle stretches of the shoulder, arm, and hand. Using NSAIDs like Advil, ibuprofen, or Aleve may help decrease pain and swelling. Maintaining full use of arm and range of motion of the shoulder helps reduce tightness. Please see the teaching sheet titled Arm Exercises After Surgery for more information. If needed, a referral to physical or occupational therapy may also be helpful to reduce tightness and pain associated with cording and improve shoulder range of motion. Guidelines to follow after axillary lymph node dissection. After surgery or radiation, return to your normal activities gradually. It is important to use your affected arm for normal, everyday activities to help you heal properly and regain strength. This includes things like brushing your hair and bathing. Keep your arm clean and dry. Use daily moisturizer. Avoid tight jewelry, tight clothing, or elastic bands around the affected arm or fingers. Wear gloves while doing activities that might cause skin injury, such as gardening, working with tools, and using chemicals such as detergents. Protect your arm from sun and insects by using sunscreen and insect repellent. If you get a scratch, bite, burn, or break in your skin, wash the affected area immediately with soap and water and apply antibiotic ointment. Avoid heavy lifting on the surgical side for 4 weeks after surgery. When you are ready, start with 2 to 3 pounds and see how your body reacts. Monitor for signs of swelling as you progress your activity. Avoid repetitive motions with the affected arm, such as vacuuming for 2 weeks after surgery. If needed, it is okay to have blood pressure, injections, and blood draws performed in either arm. There is no evidence that this will cause lymphedema. Research shows that blood draws and blood pressure should be avoided in the arm only if you have been diagnosed with lymphedema or have a history of lymphedema in the arm. For more information regarding lymphedema, please reference the lymphedema fact sheet.